as the fall came, the cold weather came, and cases started to raise, we were again asked to basically drop everything. And it was pretty quick because our numbers, they were kind of steadily increasing, but then we started to see these jumps. And as that happened, our incident command was reinstituted, and they knew that we needed to start preparing for our surge capacity.
Patty's been ready since the spring for this reassignment, but wasn't called into action until early November. And the patients she's seeing now need various levels of care.
These are some of the sickest critical care patients that I've ever seen in my career, because in the intensive care unit, most of them are intubated and they're not awake. So it takes at least 2 people to be able to do what we need to do for these patients.
And while there are more COVID patients to care for, not all of them are as sick as the early wave of patients were.
I think the thing that people really forget is that this is a novel virus, so we don't know much about it. We are better equipped now with knowledge than we were in the spring. Our providers and our physicians are much more educated on what therapies work for these patients. The patients that we're seeing in the hospital, they may not be in intensive care, but some of these medical surgical patients, they're too sick to be home, and they're requiring up to like 60 liters per minute of oxygen. I mean, it's a large oxygen demand. Yeah. And it's not just a respiratory virus. We're learning that it's a vascular virus. So you can have different types of presenting symptoms. Definitely, we have more knowledge, and the more we know, the more effective we are with our treatments. The nurses that have been on these units have shared a lot of this information with me. I try to keep up on it as much as I can, but they were talking to me from their experience that we aren't seeing some of the crisis that the patients went into in the spring, because we're preventing some of those issues because we know better what to do right off the bat.
The process of caring for these patients that Patti is now a part of is also getting better as the pandemic goes on.
It's a team effort. And like you said, the nurses would be the intensive care nurses are in the room. Well, they've learned to write backwards. They write on the glass with dry erase markers what they need. I would run and get the glucometer for them or a piece of equipment. I would get medications for them. And these are things that a CNA can't specifically do, but we also help with moving the patient and repositioning them.
While Patti's early on in her work back at the bedside, she takes great pride in also shoring up her fellow nurses who have been on the front lines of the pandemic since the beginning.
These bedside people have been dealing with this issue since the spring. And they're tired, and I'm tired, and I've only done it for a week. So I can't imagine the amount of exhaustion that they're going through, and just being able to give them extra hands has been very rewarding for me. And they've expressed their appreciation, because I had several people say, you really, really saved me today. And that makes it all worthwhile.
How long are you prepared to do this?
We don't know. We are working weekends, we're working night shifts, and we are working holidays. Not every holiday, but the group has signed up to cover those shifts so that we're providing help around the clock. Personally, I don't think COVID's going to go away on January 1st, 2021. So my expectation is that it will be extended until our surge numbers start to, level off and start decreasing, which is not going to happen anytime soon.
I asked Patti if she could speak to our community. What would she say as we head into what is usually a week of large family gatherings and Thanksgiving?
We really need to we have to follow the guidelines that our state health department has outlined for us. And we need to wear our masks. We need to wash our hands. I am like the mask police at times, and it's so important because it makes a difference. So we do need to follow those measures. We need to stay in our right now. They're recommending that you don't interact with other families. You keep it within your family unit, and it's just to slow the spread, because we know the prevalence of COVID in our community right now is so much higher than it's been, that we really do need to take specific precautions to give us a break, and to just, give your community, your hospitals, some breathing room.
With a good amount of her previous bedside experience in the emergency room, Patti anticipates working some shifts there as well and wants to remind everybody not to ignore medical emergencies and seek the life-saving care they need.
We're still taking care of our trauma patients. We're still taking care of our stroke patients, our cardiac patients, and we're making room for them. But, you can't shut the front door, and it's, all hands on deck.
I'm always watching out for your health. I'm Ira Cronin.